Full mouth rehabilitation oftentimes comes out during the discovery portion of an exam because very few patients know to come asking for a full mouth rehabilitation. But when a full mouth rehabilitation is necessary for many patients, in my opinion, there's 3 reasons why someone might be eligible or might have the necessity for a full mouth rehabilitation. One is the obvious neglect. I see many patients in my practice who have neglected going to the dentist for 10, 15, sometimes 20 plus years. So there's a lot of decay, there's a lot of things, maybe even some missing or broken teeth. So there's just a lot of things going on in the mouth that we might need to rehabilitate the entire mouth in order to fix even their chief complaint. So that's one of the reasons why full mouth rehabilitation is important. A second reason sometimes patients come to me for full mouth rehabilitation is maybe they have been taking care of their teeth through the years, but maybe they're a little bit older, they're into maybe their 3rd, 4th decade of using their adult teeth, and maybe they've also gone through 2, 3, 4 decades of dentistry. Well, the dentistry at that point is a little mismatched. You've got one color crown on the right and something else on the left, and then a filling that doesn't quite match. And so sometimes people come to me because they see the smiles on TV and they want their smile to look like that. They realize they've taken good care of their teeth, but they don't understand why their dentistry doesn't look like that. And sometimes I say it's like they have a museum of dentistry in their mouth. They have lots of different materials, different colors, different textures, and so we need to do a full mouth rehabilitation to just make it all match. So that's oftentimes where we're taking off existing dentistry just to get their dentistry to match. So that's one example of full mouth rehabilitation. The third, and probably the most common one that I see, is when people come in with chipped or broken front teeth. And so they've seen the pictures of veneers and things like that, and they want a new smile. But what they sometimes don't realize is that the front teeth are chipped or broken because something in the bite has collapsed. That's very, very common, particularly after 2, 3, 4 decades of using your teeth. The back teeth and the front teeth tend to wear down. And in order to make the front teeth look pretty and more youthful and sometimes even bigger or longer, we have to full mouth rehabilitate, which means we have to open the bite in the back so that we can give them the pretty longer, more youthful teeth in the front. So those are the 3 main reasons why we discover sometimes that a patient is needing a full mouth rehabilitation.